Ben. I'll be back a little bit later.
Morning everyone. Hi Alex, how are you feeling?
I'm okay.
Morning Jenny.
Hi, this is my mum Liz.
Hi, pleased to meet you Liz.
Hi, Doctor.
Ben Saxon, I'm one of the haematologists involved in Alex's care. Jenny, we need to speak about a couple of treatments for Alex today. Do you want us to wait for Tom?
No, that's fine, I'll just let him know.
And is it okay to speak in here?
Yeah, that's fine. Alex can listen, and then if Mum's got any questions.
Okay, great.
Okay, thanks. So Alex, is Dad around?
Dad's at work, but he said he'll pop in later.
Okay. Well, if Tom has any questions about what we're talking about today, then I'm around later today, or one of my colleagues.
That's fine. We'll just give you a call later on if we've got any questions.
Okay. Yesterday we were talking a lot about blood. Do you remember anything about platelets?
So they're the things in Alex's blood that control the bleeding?
Yeah, that's right, and they've been low for a while. So they're made by the bone marrow. That's the factory for the platelets, in fact, the factory for all of our blood. And we know that that factory is not working that well for Alex.
Okay.
And her platelet count's been dropping down, and it's now really quite low. It's around about 10, which is lower than we would like for putting the central line in today.
How much should she have? What should her level be?
So a normal platelet count is above 150. So 10 is really quite low. Most children don't run into any problems at all until it's below about 20 or 30. And as you can see, Alex hasn't had bleeding problems even with a platelet count of 10.
Okay.
But we know that having an operation increases the risk of bleeding. So it would be better if we could get the platelet count higher.
Yeah, so how do we do that?
The best way to increase the platelet count to make the procedure safe today is to give a platelet transfusion. Alex, I know you've been listening to a lot of this. Do you remember anything about platelets?
Someone might have said something, but I don't really remember.
It's all a bit of a blur, really. Maybe you could go over it again for us?
Yeah, sure. Alex, do you remember how we were talking about your bone marrow is like a garden?
Yeah.
And it should be full of plants and flowers and things. And at the moment, your garden's really very empty.
So, I don't have any platelets?
No, you don't have very many, and we'd certainly like you to have more.
And they control the bleeding somehow.
Yeah, what do they actually do?
Platelets are tiny little cells that when a blood vessel's damaged, like when we cut ourselves, the blood vessel contracts down to stop the bleeding, and then the platelets rush there and form a plug.
Okay.
And they work with proteins to form a block so the blood stops coming out. Platelets control bleeding whenever there's an injury, which is why I'm recommending a platelet transfusion today before the central line. This is an information sheet about platelets and platelet transfusions.
Okay. So what could go wrong?
So with anything in medicine, there are risks and benefits. And even though Australia has one of the safest blood supplies in the world, there is still some risk attached to it.
Yep, so what are the risks?
There are 3 key risks that I'd like to go through with you. The first one is that Alex could have a reaction to the platelets. Those reactions are allergy sort of reactions.
Right.
So usually a minor rash or a bit of an itch, sometimes a temperature. Those things just go away by themselves. Very rarely, those allergic reactions can be quite severe and her blood pressure could drop and she could become really quite unwell. We call this anaphylaxis. I don't know if you've heard of that.
Yeah, so what happens if Alex is one of the rare people who does have that reaction?
We'll be monitoring Alex very closely from the start of transfusion all the way through. And if there are any signs of a problem, we stop the transfusion immediately and start special care to correct that reaction.
Okay, so there'll be someone watching her the whole time.
Fiona or one of the nurses will be with her right at the start of the transfusion and do a set of observations, and then a few minutes later as well. This is really important because those sorts of reactions, if they happen, they happen early in the transfusion.
Okay. So what about the second risk?
There is a risk of infection with any blood transfusion, but this is much lower risk than the reactions that I've just talked about. So there's two types of infection. One is a bacteria that can come across with the platelets and go into a bloodstream.
Yep.
And we can recognise that by a high temperature, and we can treat it with antibiotics.
Okay.
The other type of infection is a virus. You may have heard of hepatitis or HIV, and that they could be transmitted through blood. They are really, really rare nowadays. The type of screening that we go through with the donors and the testing of every unit of blood minimises that risk down to something that we hardly ever see, if ever.
Was there another risk?
There's a very rare risk with all of the thorough checking we do to make sure that we're giving the right blood to the right person. There can sometimes be a clerical error and she could receive the wrong blood. This is a very rare situation and usually doesn't cause any harm.
I mean, everything that you've told us makes sense. I can't help but still be worried.
What worries you the most?
Basically, Alex getting the wrong blood, and then having a reaction to it. Like, wouldn't it be better if Mum or I donated our blood? Would that help?
Look, that's a great question. Your blood and Alex's blood is really similar, but not identical. And there's actually a rare immune reaction that can happen. And we actually prefer to give unrelated donors' blood rather than family blood. So the blood that we provide in Australia is well tested and very safe.
Okay.
The biggest risk Alex faces at the moment is actually having some bleeding when the central line goes in, rather than all of these risks that we've been talking about with the transfusion.
Sounds like the transfusion's the best treatment for Alex right now. I'm just wondering though, Doctor, is there anything else we can consider, any other treatment at all?
Some of the medications we're talking about using to treat her bone marrow will actually help bring the platelets up, but it doesn't work very quickly. It's only a platelet transfusion that can bring the platelet count up fast enough for us to get the central line in today.
Okay.
There is a medication called tranexamic acid, which can help once you've made a clot. So once those platelets have gone and blocked up the bleeding, the tranexamic acid can help stabilise that, but it's not really a substitute for giving a platelet transfusion before an operation.
Okay. I mean, yeah, I guess we'd go ahead.
Okay. This is our standard consent form in the hospital, which I'll go through with you in a moment. Fiona, perfect timing. We've just been talking about platelet transfusions. Would you mind going through the process and procedure about giving a transfusion?
Sure. Normally with a platelet transfusion, children need a small plastic tube placed in one of their veins. In Alex's case, we can use the one that her fluids are running through now. The transfusion lab will send platelets that are compatible with Alex's blood type. Once the platelets arrive here on the ward, two nurses will carefully check the platelets and paperwork match Alex's exact details.
Okay, so it's double check.
Yes, it's double checked by two nurses.
Right, okay.
Once we've done that, we'll hang the platelets and run them slowly through an IV pump just like this one, and that will take about an hour to run through. Whilst the platelets are running through, we'll monitor Alex's temperature, heart rate, blood pressure, and her respiratory rate for any changes. It's unlikely Alex will feel any different whilst the transfusion is running through, but if you have any problems at all or any concerns, please let us know immediately.
Okay, thank you.
You're welcome.
Great, thanks very much, Fiona. So Alex, if you feel bad or funny in any way during the platelet transfusion, let somebody know. Let your mum know, or grandma, or Fiona, or one of the nurses.
Yeah.
Do you have any questions about any of this?
Actually, I do. After the transfusion, am I going to feel any better? Because I really want to get back to my dance class.
So this platelet transfusion, you'll probably feel about the same straight after as you do now, but we really want to get you back to your dance classes, and that's what all of the other treatment to make your bone marrow grow back again is all about. So does anybody have any other questions at the moment?
I think we should just get started.
Okay. If you come up with any other questions, please get in contact with me or Fiona or any of the team.
Sure.
So right now we just need to go through that consent form together.
When a blood transfusion is being recommended as a treatment option for a child, it is vital for the parents or legal guardians and the child to understand the benefits of and reasons for the transfusion, the potential risks of transfusion for their particular situation, any other treatment options that should be considered, and what is actually involved in the process. This discussion must present information in a way that can be easily understood, include the opportunity for parents or legal guardians and the child to ask questions and have them comprehensively answered, ensure that the family's needs, priorities and beliefs are taken into account, and recognise that these considerations may influence decision making, and make clear that the need for any treatment, including transfusion, needs to be made jointly between the medical team, the parents or legal guardians, and the child. Remember, to give informed consent, it is essential that the parents or legal guardians must understand why transfusion has been recommended and what the other possible treatment options are. They must also be informed of the expected benefits and potential risks or side effects and understand the process involved in giving the transfusion. This video aims to make clinicians, patients, and parents or legal guardians aware of the information they should know when consent is being requested for a blood transfusion in paediatric settings. This video is not intended as medical or professional advice. The disclaimer found at lifeblood.com.au applies to this video.